You've been diagnosed with a lower extremity ulcer or wound. The underlying problem in wounds can be one of many different issues, and these have to be addressed individually. The first problem that we see in a lot of patients is underlying arterial disease, meaning that their circulation is such that they don't have enough blood flow to heal the wound. This is worked up with the PVRs initially, which are pulse volume recordings that allows us to see if there are blockages in the arteries leading to the area. If that is abnormal, then we proceed with further diagnostic testing, such as an arteriogram, which will allow us then to treat the area of blockage either with a balloon or a stent, or sometimes patients need vascular surgery in the way of a bypass to get better blood flow to the area of concern. The second problem that we see sometimes in those patients with lower extremity ulcers would be a venous issue. Veins take blood from the foot back to the heart against gravity. If those valves don't work well, that keeps blood flowing in the correct direction, then blood will pool and you will end up with an ulcer sometimes in the ankle region or sometimes on the foot. This is then treated by and worked up first by ultrasound so we can find out what veins are involved. Those veins can then be treated either by removal, which is surgical removal, or by using a special energy source, either a laser or radio frequency, which is heat, that then literally will fry the vein shut so that blood can no longer flow through that vein. And that allows then for decreased pressure and the wound can then heal. Lastly, you could have a problem that's more a pressure problem, and those problems are typically seen in diabetic patients where they don't feel the ulcer starting to form, and when the feeling is not there, the ulcer continues to get worse. Other problems that we see, those patients then need to be treated with what we call offloading, and that either means a special orthotic in a shoe or a special shoe so they don't put pressure on the given area, or it can be sometimes offloaded internally, meaning that the bone is removed. Once this has been done and these three different disease processes have been ruled out or treated appropriately, then we have many ways to treat the wounds themselves, either with special dressings. There are advanced therapies that we can offer in the way of skin grafting, as well as then hyperbaric oxygen therapy in those patients if they fit the proper diagnosis codes. I don't know what else to say. How's that? Once the underlying problem has been determined in your wound and that has been treated, in addition to treating the wound itself, we have to make sure that there's no underlying infection. If there is, then that is treated. If there is edema or swelling involved in the wound, then we have specialized dressings that we can place along with compression stockings that can be used to help with the control of edema. And sometimes x-rays are done to rule out underlying bone infections that sometimes we don't realize are present, and that needs to be treated as well. In addition to that, then we have hyperbaric oxygen therapy in those patients that fit the appropriate diagnosis codes for that to help heal the wound and increase the amount of oxygen in the area for wound healing. Underlying nutritional problems are also needs to be dealt with. Increasing protein intake to help heal the wounds is important as well.